This is a podcast of the Nuffield Department of Medicine. Today we speak with Dr. Vicki Marsh about her research on science and society. Hi Vicki.
Hello.
So can you give us an example of this kind of ethical or social issue that might crop up in an international research collaboration?
Yes. Perhaps to just frame that first, I work within the Oxford Tropical Network as part of the Centre for Tropical Medicine and Global Health, and I've actually been based in Kenya working at a collaborative programme on the coast of Kenya for most of the last 20 years. And that's a setting in which people experience a lot of poverty and health services can be very overstretched. So that immediately presents lots of issues in relation to what researchers' responsibilities are to the communities and study participants and other stakeholders that they interact with in that kind of situation. So that's a very important part of my work.
I see. Now how do you actually solve these sorts of issues?
The way into this is to really try to characterize the issue in a lot of detail. So this means taking a kind of theoretical standpoint to look at guidelines, literature, ways in which people have thought about particular problems in the past and drawing on that. In our practice, it also involves talking to a lot of local stakeholders, so community members and study participants and so on, and trying to bring their views into that overall analysis. We often find we also need to do more research to find out more about the issue in question, and we will try to develop relationships with other agencies or institutions, particularly the Ministry of Health, because it often turns out that some of these responsibilities of researchers can be shared, but that generates new responsibilities in terms of perhaps capacity building.
I see. What advice might you give to someone who's, say, contemplating doing health research in a complex setting like this?
So this would definitely again come back to engaging and involving different sorts of stakeholders. Study participants, community members, those who provide health services in that setting, and there will be other relevant stakeholders. Critical to understand the context and to build relationships with those stakeholders in order to support your research.
What are the most important lines of research that have developed in this area over the last 5 to 10 years?
And perhaps I can talk about some of the areas that I've been directly involved in without assuming those are the most important. Certainly an area that I have been very fascinated in is health systems research and access to care. So I was involved in a whole series of studies on the way in which people manage children with malaria at home, recognizing that most children with malaria in Africa, if they die without any contact with health facilities at all. And very often they're being treated with over-the-counter medicines bought from nearby village shops. So there were a series of projects that worked through feasibility, proof of principle, moving up to national level inclusion in the malaria control programme, and then trying to evaluate at a national level how that kind of strategy would work. My current work is more based around community engagement in research. This is a set of ethical issues, and I'm particularly interested in looking at goals, approaches, and ways of evaluating that.
I see. Why is your research important? Why should we fund it?
If you believe that international health research in low to middle income country settings is important, then the kind of research that we do, it follows, is also important to strengthen the ethics of that type of research. And the argument, of course, would be that the majority of deaths and disease globally are borne by low to middle income countries, and research is an important way of trying to address those challenges, both for health and also for economic growth.
How does your work fit within translational medicine, within the department?
Well, I think that the kind of research that we do, the area I've been describing to you, maps very directly onto policy, because we're actually looking at research policy and how we can strengthen ethical practice within research policy. And obviously the work that we're doing is quite context specific in taking account of local views and local social realities. So that does give some challenges in terms of transferring those findings to other kinds of settings. But one way in which we're able to do this is to think about methodologies and applying methodologies in different places, and also by sharing our findings within international collaborative networks that we're part of, particularly around bioethics, which allows us to compare and contrast the findings in different settings.
Thank you, Vicki. That was really illuminating. Thanks.
Thank you.